Welcome to Image in Alaska. My name is Ward Hinger. I'm the Chief Administrative Officer for Alaska Radiology Associates and CEO for Image Associates. Image Associates is managed by Alaska Radiology Associates, managed by doctors for doctors. Well, today we have a very special guest and a friend of mine, Melinda. Good morning, Melinda.
Good morning, Ward.
So I'm just going to read a little bit here about you that I was able to glean from the internet. Melinda has served as Executive Director for Anchorage Project Access for over 6 years. She has a master's degree in counseling psychology and is a licensed professional counselor and a certified clinical supervisor. Melinda has been in health-related positions in Alaska for over 43 years. She has worked as the Executive Director in behavioral health and healthcare fields, overseeing comprehensive substance abuse and mental health treatment programs. Regarding accomplishments, Ms. Freemon is a recipient of the 2012 YWCA BP Explorations Women of Achievement Award, as well as 2012 Hard-Won Victory Award by the American Planning Association of Alaska Chapter. More recently, with Melinda at the helm, Anchorage Project Access has received the Alaska Public Health Association's Health Equity Award in 2021. Wow, what a resume, Melinda.
I've been blessed in Alaska to have this amazing career working with people.
Just incredible. So, Melinda, in a quick nutshell, what is Anchorage Project Access?
Well, thank you for having me, Ward. Anchorage Project Access is a nonprofit organization that functions under our parent nonprofit, Christian Health Associates. Anchorage Project Access was started in 2005. And what we do is we were formed to assist people who were underserved in our community and had no access to specialty health care.
Wow.
And we both know that impacts people's lives on every single level.
Absolutely.
So we were formed to address that and to address the overutilization of hospital emergency departments. When people have no access to specialty health care, they delay their health care for years, and then they end up using the emergency department, which is not the best fit for the care that they usually need.
Neither for the system or the patient.
Mm-hmm.
Wow. And being in specialty healthcare myself for so many years, I understand the important role specialty healthcare plays in the tertiary system. So let's talk a little bit about the history of APA and how did it really launch?
Well, it launched with a group of dynamic community leaders. We had public servants, we had philanthropy experts, we had business leaders, doctors. We had this cadre of individuals who were committed to helping increase access to healthcare for people who were uninsured with low income. So for several years in the early 2000s, they met every week at 6:30 in the morning at Christian Health Associates. And from that meeting, which was called Anchorage Access to Healthcare Coalition, that group of people were so committed that they established a framework for offering donated care by specialty physicians. And that's how we started. It took about 5 years to get it going. They decided on a model which was based on the Buncombe County, North Carolina model of Project Access. We're one of many Project Accesses across the country. And then we started, and the funding went to Christian Health Associates, and that was our beginning. And we opened our first services to patients in 2005.
Incredible. And who were some of the medical doctor pioneers in this launch? Was Dr. Kaltenborn one of them?
Dr. Kaltenborn, but also his wife, Dr. Kathy Schumacher.
Yes, Kathy.
She was a powerhouse for recruiting other doctors. And in order to start this, you had to have at least 250 donating specialists.
So what does that mean? I'm so glad you brought that up. Donating specialists. So this group was reaching out to hundreds of doctors, asking them to carve out a portion of their time and resources to provide care who meet certain eligibility requirements. Is that true?
Yes. When we were established, we have the criteria that a person or a family had to be without access to health care. This was before ACA Marketplace Health Insurance and also before the Medicaid expansion in Alaska. So people had very limited access to specialty care. And then the whole structure of APA is about coordinating the donating care so that the doctor's offices, their practice managers, their staff do not have to deal with the financial aspects of
Right.
donating care. We do all of that within our office.
What a wonderful history to codify and to cherish and to celebrate. What are the services that Anchorage Project Access actually offers?
So Anchorage Project Access, think of us as the infrastructure or the engine behind this amazing generosity of our providers. We've also changed and added to our services over the years. We first started with probably about 20 or 25 specialties being donated. And then we've expanded now to 43 specialties being donated through APA. And our team, our little team of 6 people, provides all of the infrastructure to coordinate the care from screening for financial eligibility, as well as enrolling people into our services. We have a medical program manager that reviews every single referral, and we receive about 650 to 700 referrals a year. And this gentleman, Casey, provides the medical review. He has tremendous medical expertise, and he determines, according to our guidelines, does this request fit what we can provide for this patient? And then he determines a course of action for each patient.
A lot of thought goes into all of this. I'm just like being in healthcare myself. I know there's a lot of work that goes into the front end of this to make sure the right people get the right services. What are some of the barriers that you guys often see?
Our services have been developed organically over time to respond to the community needs and the barriers. So one of the key barriers to accessing services is a lack of health insurance. When people have health insurance, they're able to utilize it. They're able to get access preventive care, ongoing care. And this is what we noticed when we developed Anchorage Project Access, is that people were, as I said, going to the ER because of a lack of financial resources, a lack of understanding of how we utilize preventive and ongoing primary care. In addition, when people have to decide to keep a roof over their head, their car filled with gas, child care, or other types of medical care, they just simply often do not have enough resources to access specialty care. And so they just don't access the care, and then their situations worsen, and then they end up going to the emergency department, which is not the best way of providing services for folks.
Absolutely. And I think of all the household items that you just listed off, having a household of my own and a few businesses, I can tell you inflation has really eaten away at the purchasing power of the U.S. dollar.
70% of American households are one paycheck away from insolvency.
One paycheck away.
One paycheck away.
Incredible.
Mm-hmm.
You used a term yesterday when I was talking to you about whole person trauma informed care. That was a new term for me. Could you please explain to our wonderful Alaska audience what that means?
Whole person care has to do with responding to a cadre of needs from each individual patient. So when we're working with an individual or a family, they don't just come through the door and needing a hip replacement. They will also need physical therapy prior to the operation, and then they'll need physical therapy after the operation. Most of our families have struggled financially, as well as under many different types of circumstances, whether it's trauma in childhood, domestic violence, etc. And so their resilience is tremendous, but their needs for whole person care and the understanding of the impact of trauma for individuals, especially when we cannot access healthcare, it is very traumatic. And that is what our founders decided to help with in Anchorage and in Alaska. We do serve Alaskans as well as Anchorage residents. One of our criteria is that you have to be an Alaska resident to receive our services.
So thank you for that background in the definition. It means a lot to me now. You mentioned your team. You said you have 6 members on your team. Can you explain a little bit about what their individual responsibilities are? I think you mentioned one of the gentlemen, he acts like a case manager in a sense.
He's the medical program manager.
Mm-hmm.
So with his knowledge, he reviews every single referral. Primarily, we receive our referrals from Anchorage Neighborhood Health Center or Providence Family Medicine, but also from specialists that want to donate to a patient And they do that through working through Anchorage Project Access. So our team has specific roles, but they're very multi-talented. We have an operations manager who oversees our software system that handles all of our providers and the number of pledges they'll donate per year. Then she also handles all of our team and making sure they function smoothly. We have a eligibility and enrollment specialist. We have a dental health coordinator. We have a mental health counseling coordinator. And we also have the executive director position. And those folks, we also have a few folks on contract that help us. But we also do so many different things in this effort to provide whole person care. We added dental in 2016. We added mental health counseling in 2023. And we also added enrollment into health insurance in 2015. So we enroll patients into ACA Marketplace Health Insurance, Medicaid, and Medicare.
Those services did not exist when I first joined as a board member in 2007. And it was a pleasure to serve back then. I did take a position outside the state of Alaska. And when I came back, I was eager to come and serve again. And that's when we met. And since we met, I've watched you really grow and expand in an appropriate way the services of Anchorage Project Access. So I want to thank you for your vision and leadership in doing that. That's quite incredible.
Oh, thank you very much for being one of our main champions at APA.
Always will be. Can you talk a little bit, Melinda, about the providers, the specialists that participate in your program? Can you mention maybe who they are? I don't know if you have time to do that. Just give a shout out on that.
Sure. So we so greatly appreciate the generosity of our providers. In our annual reports that we produce every year, we focus on a single provider who represents so many generous physicians.
And this is your annual report here?
Yes.
And this is going to be coming out when?
Our 2025 annual report will be coming out in the next month, and it's our 20th anniversary report. So it covers 2024, but it's a reflection and a look back at our 20 years of service in Alaska.
Now, you just handed this to me, and I interrupted you. I want to get back to the doc stuff. Yeah, but you just handed this to me a few minutes before we begin this podcast. Looks so professional, so clean. How do I get a copy of this? Is there...
We have access to the copies on our website, anchorageprojectaccess.org. We send out several hundred of these annual reports. We also have them in our office. We drop them by providers. Let's talk a little bit about the providers that you mentioned in focusing.
Let's do it.
So featured, of course, you've been featured in our annual report as a champion for Anchorage Project Access. We've also featured Cinderella Tollefson, who oversees Alaska Health Services and the Alaska Trauma and Acute Care Services Center, over 17 surgeons that donate their care. In the 2023 report, we feature Alec Kay, who is the lead PT for United Physical Therapy. And when we talk about 42 specialties, those are 42 specialties that encompass around 800 providers that are donating to APA.
How impressive.
And so we have pulmonology, cardiology, oncology, dermatology, physical therapy, and all of the ancillary type care that is needed for people to become healthy and restore their health.
That must take a lot of effort to maintain those relationships.
We have a fantastic board of directors that not only give usually donated care to our patients, but also serve on our board of directors, and they donate financially as well. And so it takes our board of directors who do most of the recruiting of their peers, and often they do that with great enthusiasm and passion. And then our staff help maintain and retain the providers. Every provider decides how much they want to pledge, how many services, how many surgeries, how many oral surgeries they want to provide. And then we do all sorts of efforts throughout the year to thank our providers. This is an example of having this wonderful podcast with you where we can thank our generous specialists for donating, and our healthcare partners,
right,
from Providence to Alaska Regional to the clinics And, we serve anyone in Alaska who can either come to Anchorage for the services, or we do provide telehealth for their counseling program.
First of all, I just want to go back and think about how giving our healthcare providers are in the state. And they're facing their headwinds and challenges, right?
Yes.
They're dealing with inflation. They're dealing with staffing shortages. They're dealing with just fill in the blank. And yet they're still finding the capacity to give back to the communities in which they live in. It is really heart-touching. If I'm a healthcare provider out there and I'm not participating with Anchorage Project Access and I'm listening to this podcast and I'm like, wow, I think I can carve out a piece of my practice. And how do I connect with Melinda and her team?
So there are numerous ways to connect with us. The easiest way probably is to call me directly at 907-743-6651. Go on to our website. We have all of the provider manuals. We have the provider pledge forms. You can offer to provide us with 3 orthopedic surgeries a year, 12 if you feel comfortable and you have the capacity, or you can just do a service once per month. We have ENT specialists of Alaska donating. We have ophthalmology practices, Alaska LASIK and cataract, and Alaska retinal consultants. We have over 90 dentists donating, and we were one of the first programs in a project access to add dental services.
Yeah.
And we were one of 2 to add mental health counseling services. So you can call me, you can go on our website. My direct email is mfreemon, Freemon, at anchorageprojectaccess.org.
In the past, you've shared some pretty heart-touching stories of, our friends and families that live in the communities that actually are able to participate in Anchorage Project Access and the impact it's had on their lives. Is there a story or stories that you'd like to share this?
Yes, we have so many, but I'll just select a few. So when I think of a patient that is really thriving, I think of Jamie. Jamie was a cook for about 40 plus years in his career, always had insurance. And when he moved towards retirement, he did not have any coverage, any kind of healthcare coverage, and he needed an arterial bypass. He was very, very ill. He had nowhere to turn when he was referred to Anchorage Project Access. We have photos of him in the hospital. He actually had the surgery at the time that the 2018 earthquake occurred, and so he didn't know if it was a post-surgery or if it was actually an earthquake. He lived through that and is thriving. We have films on our website featuring our patients. And I also think of Teresa, who has been a single mom of 3 kids, and she had a very severe anemia, and she was allergic to any of the medication that could assist her. She had been a hairstylist all of her career, extremely independent, very, very giving and compassionate, and was not comfortable receiving what she considered charity care. But through APA, she was able to receive surgery donated by our local provider, and it literally saved her life. She would not have made it without that, which is the case of many of our patients. Our patients are working. They're very hard-working individuals. They want to get back to having restored health so they can work, take care of their families, and they have just not been able to access health insurance.
These are the type of programs I can get behind all day long, serving the working folks in our community that need a hand up, not a handout.
Yes.
That is simply incredible. I've actually had friends ask me how they donate as well. So other than practices, donating their services and time from their practices, individuals that feel touched by the incredible mission of Anchorage Project Access can directly give.
Yes.
Correct. And again, there's probably a link on your website that they can go to and give. And I've also had some, ironically, that that Anchorage Project Access has touched someone in their life so much that they want to include it in their estate planning as well.
Yes.
So those are great ways just to give back and to your community. So
yes,
just wanted to call that out.
Thank you.
Regarding fundraising, Revolutions is your big annual event. In fact, it just took place. You want to explain to Alaska what Revolutions is and what happened just a few weeks ago?
Sure. So we call it Revolutions Spin for Healthcare. It's a stationary cycle event. It's a hybrid event. We start it at the end of mid-January. And the live event this year was February 1st at the Diamond Center. And Ward and his team from Imaging Associates they were an absolutely amazing crowd of bicycle riders.
It was really fun, Melinda.
It was very fun. It is our only annual fundraiser. We only have that one. And every year it's focused on healthcare and restoring health. So that's why it's on stationary cycles. We have a tremendous support from the Alaska Club. They provide the bikes. They provide our fabulous champion, Janet Warner, who coordinates all of the donating spin instructors. They're all professionals. They did a great job this year. They were fantastic.
Stacy was our spin instructor this year, right?
Yeah, we had Stacy, Shelley Wade, we had Janet Warner.
Incredible.
And they are just so high energy and just really read the crowd. And so we had support from Diamond Center. They donated the venue space for us.
That was huge.
Yeah, that was significant. And our goal was $85,000, and we were so blessed to receive $95,000 in revenue from that event, which is a little over 10% of our annual budget.
That's incredible. I mean, it's just a testimony to how much our community believes in Anchorage Project Access, and to your leadership again, Melinda. I hear there's something special going on this year. Is it the 20th anniversary?
It is the 20th anniversary.
20 years.
Isn't that amazing? You joined us at the beginning. Here we are.
I'm not that old. What do you have planned for that?
Okay, well, we're working on an event to celebrate our donating providers and supporters, our healthcare champions. We're also publishing the 20th anniversary report, which I said will be out in a few weeks. And we are spending time acknowledging and looking back at the accomplishments of our wonderful community and supporting APA. We're a very lean organization, so we want our supporters and our family members and in the community to know that we take every single donation and maximize its impact. Again, another thing that we do that we didn't chat about was we provide help for individuals and families to navigate the healthcare system. It's very complex, as you and I both know. An EOB, explanation of benefits, can be quite puzzling and befuddling. And so we are here to help people navigate that.
That was my reference to case management, because I actually have a case manager that works for us with breast care coordination and our breast imaging center of excellence. But it is very complicated when you're dealing with multiple specialties. As you said, it's not usually just one. It could involve two or three. So it does take a lot of wisdom in guiding. I do want to give a shout out on your efficiency. You guys are just incredible, given your partnership with specialists and them donating the care, and your lean team of only 6 people and all the people's lives that you touch every year. You're incredibly efficient. And I think that's one of the reasons why I've just been so easy to get behind you as a board member, as an individual, and as an organization. So thank you so much for that. We covered a lot of territory, and I could sit here and talk the next hour with you, Melinda. Before we depart, is there anything you'd like for our wonderful Alaska citizens to better know or understand?
Thank you for asking. I would like folks to know that we follow the federal mandate, which is called No Wrong Door, where a patient can come in for a medical need, a specialty medical need, but they can also receive counseling if they need that. They can also receive dental care. And our dental care and our mental health services can be self-referred. Our medical referrals have to come from a medical provider, but any community member can go call us at 907-743-6600 or go online and self-refer. If you're feeling down or depressed, of course, we recommend people calling 988. But in other situations where you want to reach out and have support, we are there for people at Anchorage Project Access.
Melinda, I just want to thank you again for taking your time out, joining me this morning at the Hybrid Color Studio. Melinda Freemon, ladies and gentlemen, the Executive Director for Anchorage Project Access. And you've been doing this for how many years?
I've been doing this for just over 6 years.
And you've done an incredible job. And I believe much better years ahead. So thank you, Melinda, for your contributions to our communities.
Thank you very much. We really appreciate you too.
Imaging Alaska, expert radiology, exceptional care.